Hello and welcome. I am Diana Braun, founder of the Knee Zone, and I am so happy to be here live on a Friday. And I'm here to answer all of your knee replacement questions that you might have. Now, first and foremost, you might notice I'm alone today. That is because Dr. Sinha is, I'm going to do a little quiz in a moment here, but Dr. Sinha is here at his alma mater, and I thought, well, gosh, I don't want to let you guys down and not go live, so you're going to have me. What does that mean? Well, I'm not a surgeon like Dr. Sinha, also known as my husband and our co-author of Knee Replacement Secrets. So, to that end, just a reminder, not here to give you medical advice, but I did have both my knees replaced at the same exact time, which is not the norm, but I'm here to answer your questions. Okay, oh, Bren, I love this question. Dr. Sinha answered this question last week on Instagram. What's your opinion of muscle sparing? Okay, going back to my original, how I started this. You want to find the best surgeon. Best is that does 200 knee replacements a year, and that if they do muscle sparing, quad sparing surgery, that's their specialty, great. If they're just getting into that game, then no. You want a surgeon that has their way of doing things and they do it 200 times a year. That's what you want, whether they do muscle sparing or not, custom or not, which I had custom knees. You want them, that's their specialty. That's what they do best. That is. Now, there's a lot of scientific studies, and I've had the pleasure of reading a few. Early on, for people that have muscle sparing, they tend to feel better in the first 6 to 8 weeks of recovery. But when we look at those people's, we do the follow-up, not we, Diana, but when the scientific papers do their follow-up, they find that people, whether they had quad sparing, muscle sparing, or, standard robotic versus non-robotic, I could go on and on. It really came down to the talent of the surgeon and how well the patient followed their directions to do PT and followed their directions after surgery. So surgical techniques, not as important as the right surgeon and you doing your job afterwards. So I hope that helps. I hope that helps a lot of you, by the way. All right, everybody, have a great weekend, and you're very welcome so much. Bye.